A 59 years old present with firm irregular 4 centimeter mass affecting the upper outer quadrant of her right breast. Which of the features described below is likely encountered in the scenario in the core biopsy submitted for histopathological examination? So again, in a recap, a 59 years old present with the mass 4 centimeter mass, which is the upper outer quadrant of the breast. That means this is highly suspicious for malignancy of the breast because it presents upper and outer quadrant. Upper and outer quadrant is the most susceptible for the development of the breast cancer. And the core biopsy taken and the tissue sent for histopathological examination. So which will be less likely, that means which will be not present if we suspecting a carcinoma. Here the options are the abnormal ductal epithelial cell, angiogenesis, nuclear pleomorphism, metastatic calcification, and vascular invasion. First of all, let's see the breast cancer pathology. In case of breast cancer pathology, typical changes seen in conjunction with invasive breast cancer. Here, first of all, see the nuclear polymorphism. So what occurs? Like this is a cell and this is the nucleus. So changes occur in nucleus, changes occurs in the cytoplasmic area, and changes occurs also in the membrane. So this changes occur. So first of all, here we can see the nuclear pleomorphism, that means the changes of the nucleus. Also there is the coarse chromatin, that means the chromosome is present within the nucleus, which is typically densely adherent, but for replication it should be coarse. That means this is the chromosome, but for the replication it requires to become coarse. It becomes to loose, it becomes to separate from each other, and it should be replicable. Then angiogenesis. So angiogenesis capacity also increase in this area, because why? When tumor develop, that means from one cell, let's see, this is the one cell. From one cell there is the thousands or millions or trillion of cell develop, so they need oxygen supply. For this condition, what occurs? Blood vessel formation occurs within this cell. Then invasion of the basement membrane. So the one of the character of the cancer is the invasion of the basement membrane, because this cancer should be metastasized. For metastasis, it should be breaking down the basement membrane. Also there is dystrophic calcification, that means the blood supply going to the different part of the cell, but the growth of the cell are very, very high. So some of the cell they are not getting, some of the cell they are not getting blood supply, such as imagine this area they are not getting oxygen supply because they are central part and they are rapidly growing. So what occurs? They are the dead cell, and in case of the dead cell there calcium deposition occurs. There is calcium deposition occurs. As the calcium deposited in the dead tissue, it is the dystrophic calcification. We know there are two types of calcification. One is the metastatic, another one is dystrophic. Dystrophic calcification, that means the calcium deposition occurs in case of the dead cell or dead tissue, and metastatic calcification, this calcification occurs in case of the living cell. So this is the two important differentiation between the metastatic and dystrophic calcification. And in case of the breast cancer, there is the dystrophic calcification, not the metastatic calcification. And also there is abnormal mitosis. Normally the mitosis develop a typical fashion, that means we need 100 cell, so 100 cell proliferate. But in case of the cancer, we need not any cell, but it produces millions of cells, it produces trillions of the cells. So it is the abnormal mitosis. And also there is the vascular invasion. As the vessel present in the surrounding part, it also invade the vascular endothelium, and also the lymph node metastasis present. So breast cancer pathology, immunohistochemistry of the estrogen receptor and HER2 status also should be monitored. So the histopathological examination done by the core cut biopsy and the immunological or immunohistochemistry also should be done with this tissue, and they are the estrogen receptor, which is the ER receptor, Also, progesterone receptor should be monitored, which is the PR, and Herceptin receptor, which is known as the HER2 receptor. So, ER receptor, PR receptor, HER2 receptor, they also routinely investigated. The grade, lymphatic status, size are combined, they provide Nottingham prognostic index. So, which is the least likely for the breast carcinoma? Here we can see the metastatic calcification is false, because in the breast carcinoma or any type of the tumor, any type of the carcinoma, here there is the dystrophic calcification, because all type of the tumor growth fast and rapidly, that some of the cell cannot get the oxygen and nutrition supply, and they are dead, and the calcium deposition occurs in the dead tissue. As the calcium deposition occurs in dead tissue, so it is the dystrophic calcification, not the metastatic calcification. Other options here, such as the abnormal ductal epithelial cell, it is true, because cell type usually distort from its normal size. Angiogenesis, that means the formation of the new blood vessel, it is also true. Nuclear pleomorphism, that means the nuclear size shape alteration, it is also true. Vascular invasion, also the lymphatic invasion occurs. So only false option is the metastatic calcification. It should be, in case of breast cancer, it is dystrophic